All right, continuing our series of speeches that I say about 100 times a week, we're now going to be talking about some more techniques for cleaning your mouth, and also talking more about where bad breath and bad odor from the mouth comes from. Most patients who floss are motivated for different reasons. Some patients do it because they heard that there's a connection with heart disease and they want to live a long time. Other patients floss because they want to keep their teeth for their entire life, and they know the importance of removing the bacteria in between the teeth as well as the front and back with toothbrushing. So they clean their teeth in between with flossing. But other patients are motivated to floss their teeth and clean their tongue and everything because they're concerned and don't want to have bad breath. So now we're going to move on to some techniques to make sure that you're absolutely having the cleanest, freshest mouth that you can so your breath smells great. When we're cleaning our teeth, sometimes it's hard to know if we're doing an effective enough job. And our hygienists, work great as kind of personal trainers to help each patient make sure that they're meeting all their goals when it comes to their teeth. One little trick that we still use, even as adults here, are disclosing tablets. And this is one of my earliest memories. Back in first grade, I think, a dentist or a hygienist came to my class, and we all brushed our teeth, and then we disclosed our teeth with these little cherry-flavored tablets called Red Coat tablets. It also comes in a liquid, but we can dispense these for our patients. And you simply chew the tablet, swish, and spit, and any place that you missed getting the plaque off will be bright red or bright purple. They showed these on Glee when John Stamos was a guest star and was a dentist on the show. Hilarious episode. Anyway, so disclosing tablets are one way to make sure that you're getting all the bacteria off your teeth. But one of the hidden areas where bacteria can hide is on your tongue. And I guess I didn't need to point. Most of you know what a tongue is. But down in the grooves of the tongue, bacteria can sit down in here. And the bacteria is represented here by the green. See that? Looking at the tongue under a microscope. And a lot of patients will brush their teeth and then brush their tongue. But toothbrushes were not designed to clean down in those deep ridges. So you actually need to use a tongue scraper in order to clean that area. And tongue scraping is something that really should be done every time you brush your teeth. As I mentioned, I like to, I brush my teeth, I tongue scrape, I use a mouthwash, then I floss my teeth, then I use a water flosser also, like a Hydro Floss. And I understand that that might be considered a little bit of overkill, but I am a dentist after all. So my favorite tongue scrapers are these flexible ones, like this. The other ones look a little bit like a rake. They have a handle and then a little metal bar that you scrape across your tongue. After I'm done cleaning my mouth, and you can even brush your tongue first just to prove how much more effective this is. This goes at the very back of your tongue, and then you scrape all the way forward and rinse off. And because it's white, you can really see the bacteria that's coming out of your tongue. Your mouth will feel so much fresher after using this, and your breath will smell much, much better. So anyway, that's tongue cleaning and a review of breath briefly that comes from not flossing or not brushing your tongue. The things that you're removing there are bacteria and sulfur compounds, and that's where the bad breath comes from. If bad breath persists after incorporating all the flossing techniques we've been reviewing and the tongue scraping, then it's time to look farther down the pipe. And so tonsil and adenoid retention, enlarged tonsils and adenoids can retain food debris, which then rots back there and can create an odor issue. So that's something that really should be reviewed by your dentist or your ENT and examined to see if it's a problem for you. If that's not a problem, then the next area to look at is the stomach. Sometimes we can have a weak esophageal sphincter, gastroenteral, long word, GERD, reflux disease, and that can cause the food contents and the acid and stomach contents to come up in the esophagus and cause a bad odor also. If the back of the throat issues and the stomach issues are dealt with and you do all these techniques, then when you go to bed with a fresh, clean mouth, you can actually wake up with fresh breath too. Morning breath is evidence that perhaps there's still something going on, either with ineffective cleaning or something down the pipe. Hope all that helps.